Hello, my name is Julia Vici, and I would like to talk with you today about my chiropractic internship at CEDO in Wilmington. I did this as a student intern, and I was able to shadow under Dr. Brian here and Dr. Ashley Smith to give you a little bit of background about the type of professionals that they are. They are both doctors of chiropractic. And after attending their undergraduate universities and receiving their bachelor's degree, they had to then go on to chiropractic school for another 3.5 years to earn their doctor of chiropractic. They have both been working for 20 years and 12 years, respectively, and have a wealth of knowledge and experience between the two of them. In the office, additionally, there was a chiropractic assistant, which is a 26-hour course composed of online training and hands-on in-person training. There was a front desk secretary and someone who worked as a full-time liaison between CEDO Chiropractic and insurance carriers to make sure that everybody was getting their insurance needs met. I posted their contact information that you can see on the top right. And I wanted to share with you a little bit about my agency's mission, their goals, and their structure. So their mission statement is a place to get well and stay well. Their goal is to assist people in reaching their optimum health potential. And they do this in a structured way through individualized patient care plans that remove nervous system interference via adjustments. Typically, patients, depending on where they're at in their care, will come anywhere from about 3 times a week to maybe 1 time a month if their spine is in excellent condition and they don't have any recent traumas. For example, those who have been in car accidents recently would probably need to be going more often, or someone with extreme scoliosis may also need to be getting in there more often for adjustments than others. Their entire goal is to help patients remove the subluxations that can cause so many issues in their life, whether it's showing up through symptoms or not. Subluxations are very damaging to the body, and chiropractic adjustments help remove that nerve system, that interference to the nerve system. The populations that they serve are anyone and everyone. People of all ages can benefit from chiropractic care. I personally saw infants adjusted all the way through those in their late 90s. They say that anyone with a spine can benefit from chiropractic care. And I make the analysis that similarly to how you visit the dentist regularly to prevent cavities, you can also visit the chiropractor regularly to adjust subluxations and prevent bulging discs and more illnesses down the road. And then I also included a picture of Dr. Brian here and Dr. Ashley Smith. Dr. Ashley Smith is on the left and Brian here is on the right. They've also won a bunch of awards for their office. It's very well known in Wilmington and has become a very reputable place that a lot of people have seen amazing results from. So what I did with my internship, my project included creating a comprehensive new patient education packet to increase awareness on the importance of spinal health, as well as what changes were strongly recommended for patients to incorporate into their lifestyle to see greater results in between visits. This included anything from different exercises that were recommended to increase more mobility in the joint spaces and tissues to allow for better adjustments, as well as information about nutrition, information about backpack ergonomics for children, and some good information to know around sleep hygiene, work ergonomics, and exercise ergonomics. My day-to-day responsibilities generally included a lot of assisting with COVID cleaning compliance protocols by sanitizing in between patients. I also did a lot of observing adjustments. There were chiropractic adjustments, decompression therapy, laser therapy. The office also offered massage therapy. And I, in general, was very self-motivated to learn about every area of the practice and all of those previously mentioned therapies. There was always something to do, and I was always either hands-on working to assist with COVID compliance cleaning or busy watching new patients come in and learning about all of the behind the scenes paperwork that goes on with that, or sitting in as doctors describe what the best course of treatment would be for someone, or seeing how x-rays are set up, seeing how x-rays are read. There was always something interesting going on. I think the most important learning that occurred for me that took place during this internship was that it really helped instill in me that chiropractic is something that I am very passionate about, and it's the right fit for me for a career. I had been searching for a profession that I would have a lot of passion for, and having and knowing and believing the why behind chiropractic helps me be confident that this is the right path. So I'm grateful for this opportunity for confirming that for me. What I most liked about this internship was that the doctors saw me as their peer. They didn't treat me as a student or someone who didn't know anything or have anything valuable to add. They always listened to what I had to say, answered my questions, and would speak to me as if I was already one of their peer doctors who could help make good inferences about a patient. What I least liked was that I'm not already a doctor. I wish so badly that I could be making adjustments, making diagnoses, doing the x-rays, being the one to talk to patients. But I've got some schooling to go before I can be that person. Public health domains that were addressed, 1.2, 2.2, and 4.4 and 4.6 specifically were most applicable. Those included assessing existing information and data related to health, and this happened via diagnostic codes and pertinent patient history. Developing goals, this happened via my internship project based on patient needs and what the chiropractic office could benefit from. Collecting and managing data via adjustment codes and individualized patient care plan information, and interpreting results through x-ray readings. The doctors did this, but I got to observe how they did this and why they did this. Funding, CEDO is a for-profit business, but they do not turn anyone away due to need. They are excellent at working with people who may have financial constraints, but could still really benefit from adjustments. One of the benefits of having been in practice for over 25 years and being well established and having a mix of backgrounds of patients they see is that they can accommodate for people who may not be who may not have like lots of spending money, but who need access to this. Health equity is really valuable and important to them. But patients can use insurance towards their care, or they can be what's known as a cash patient, which means that they're not using insurance and usually can result in a discounted rate. If you mention my name, Julia Amici, you can get free x-rays and a free week of adjustments. I've been referring all of my friends and family, and I would love for you to be able to take advantage of this as well. I'll leave off with the most memorable experience. The most memorable experience that I had with CEDO Chiropractic was when Dr. Here adjusted a 5-year-old infant and her postpartum mother. This mother had a really traumatic birth. Her mom actually had passed away while she was in labor. And there was just a lot going on. But I was able to see how gentle the experience was for this newborn baby. And the amount of pressure that was applied was similar to that you would apply to a piece of fruit when you're checking to see whether or not it's ripe or not in the grocery store. It was such a unique experience. There was so much heart and passion involved in there. And overall, I am just so incredibly grateful for this opportunity. Thank you for letting me share.